This is Kim Newlove, host of the Pharmacist Voice Podcast. Thank you for joining me for episode 95. If you're new to the show, welcome. I alternate solo shows and interview shows. The solo shows are about my career change from pharmacist to voice actor, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. My website is thepharmacistvoice.com. Today's episode is an interview with Mariam Altheraawi. Mariam is a fresh, new generation pharmacist. She graduated with a Bachelor of Science degree in pharmacy in 2018, and she hosts a pharmacy podcast called IVPN Voice. She loves to use her voice to inspire and empower pharmacists her age to improve the profession as they know it. She interviewed me for her podcast in April 2021. I'll put a link to that episode in the show notes. She did a great job. I'm proud to know Mariam as a fellow woman pharmacist podcaster. And without further ado, here's my conversation with Mariam. Hi, Mariam. Welcome to the Pharmacist Voice Podcast. How are you?
I'm great. Thank you for asking, Kim. It's so lovely to be on your podcast today. How are you doing?
I'm good. It is 10:30 in the morning here in the United States, and you are where?
So I'm in the United Arab Emirates, and it is currently 6:30 p.m. my time.
Okay, I bet you had a full day of work already, right?
Yeah, I'm still in the meeting room because I couldn't leave work, so I just, finished work and came straight here to, record this with you. So I'm still in work mode.
You are dedicated. Thank you for being with me.
No, it's my pleasure.
Well, I invited you to be on the show today because you are a fellow pharmacist and woman podcaster. I would love to hear how you use your voice as a podcaster.
Okay, so I don't have an inspiring story like a lot of your guests do, but I'll just share my story and then maybe, someone can pick something out of it. So I'm still a fairly fresh pharmacist. I graduated 2 years ago, and I recently started my first job ever. So this podcast thing started when I was an intern, and my director there saw something in me that I could not see, and he asked me to present something in a conference here in Abu Dhabi. And so I'm part of this IVPN network, which you may or may have not seen on LinkedIn. They're very big on LinkedIn. So it's a pharmacy network that is focused on exchanging knowledge and making talents visible, at least in the Arab region, at least. But it's expanding a lot now, and you see a lot of people from all around the world on it now. So I was working with them. I presented in that conference of the IVPN, and we were planning for the next conference. And then I started thinking, being a big podcast fan myself, I thought, why not have an auditory extension to this IVPN network, something for people like me who don't like to go through, big emails and listserv stuff, and just have everything listened to when, you're driving or you're doing something. So I pitched that idea to them, and they just loved it, and they made me in charge of the entire thing. So no pressure, right? So it's still fairly new, and we're learning a lot of things along the way, but we're having so much fun, and that's what matters. It's my mission for this podcast is to make an extension to IVPN that's fun and accessible to at least the younger pharmacists.
Very good. Well, I'm proud of you because I know how hard it can be to get a podcast started.
Thank you. Thank you.
For some, it's easy. For some, it's a little harder. I wanted to make sure I was very intentional about what I was doing with my podcast. And it sounds like you are too. your podcast exists to serve those in your region, right, the Arab region, and to inform them about what the IVPN network does. And I've looked through your Instagram and I looked on the website. Can you tell me what IVPN stands for? I know this, but for anybody listening that doesn't know, what does IVPN stand for?
Okay, so IVPN is, the basic scientific abbreviation for intravenous parenteral nutrition. This is how it all started back in, I want to say like 10 years ago. I mean, correct me if I'm wrong. Someone is going to come at me and tell me the date is wrong, but it started a long time ago. And the director of the IVPN, Dr. Osama Tabbara, he is a pharmacist who had this passion for intravenous parenteral nutrition. So when he started the main email group, or this mail listserv, it was to just exchange knowledge about just IVPNs. That's it. That's how it started. So enteral feeding and just how you compose parenteral nutrition and stuff like that. And then from there, it just kind of, snowballed and became this like multifaceted thing that has over 10 subspecialties now. So yeah, IVPN is intravenous parenteral nutrition. They didn't want to change it because they wanted to stay true to the reason it started and the vision for, or the vision of, Dr. Osama Tabbara, the director of the network. So yeah.
Okay. And have you interviewed him on your podcast yet?
I have. It wasn't an individual interview. He's not very big on being recorded, I found out.
You don't know till you ask, right?
Exactly, right? So the only reason he was on the podcast, so we launched the podcast with him on the first episode. So it was him and 3 other pharmacy leaders from different regions from the Arab world, or actually we had one from the UK. So you can't really just narrow it down to the region anymore, I guess. So we have 4 pharmacy leaders, and we were just talking about leadership in the pharmacy world. And considering he is, one of the best leaders I've met or I've dealt with, I had to have him on that podcast. But he hasn't been agreeing to be on the podcast anymore. But that's okay. We got him once. That's fine.
Yeah, he gave you a good start on the first episode, right?
Exactly. We started it big with him, and that's good for now.
Yeah, and you mentioned that you have a reach beyond the Arab region. I noticed on some of your podcast episodes that you've interviewed folks from Canada and Argentina. Is that right? And they're considered
Yes.
ambassadors. Tell me what these ambassadors are.
Okay. So considering the reach that IVPN is trying to go for, Dr. Osama decided to appoint ambassadors in every country that they want to expand in. So we have around 30 ambassadors, I want to say. And if you look, I think there's a post on Instagram that shows where every ambassador is from. And you would be able to see how far the network has grown. And it's really, really astonishing to see, considering that this expansion only happened about a year ago. Before that, it was only just limited to the emails and just mainly pharmacy and parenteral nutrition questions. So this expansion over the year is just to allow people in their countries to spread the mission of IVPN and empower people in their profession, because pharmacy in a lot of regions in the world is not as of a respectable profession, I want to say. I'm not sure if you see that in the USA. So a lot of people try to follow the USA model because that's where pharmacists are seen as like drug experts and medication professionals who really know the ins and outs of patient care. But in other parts of the world, they're not treated as that. They're just treated as people who sell medications, and that's that, right? So it's the vision of IVPN is what is inspiring people to spread it out to their countries.
Okay, so to promote the profession of pharmacy among all countries, to empower pharmacists to practice at the top of their license.
Exactly. Yeah. You said it better than I did.
Well, thank you. I'm just trying to put vocabulary to your idea. And along that vein, I would just like to ask, what is it like to be a pharmacist in the UAE?
I don't know how to answer this question considering I haven't worked long enough. So I've only been actually working as a pharmacist for 7 to 8 months. So I don't know much of the premise of the profession. But as I said, you're not expected to voice your opinion about people's medications. So if you see a problem with a patient's prescription, for example, you do not have the autonomy to, change and make sure that the right medication goes out to the patient, or just to, maximize the benefit of whatever medication you're prescribing. So I would say there's a lack of autonomy in the profession here. That's how I would put it.
Okay, thank you for sharing that. It sounds like you don't have the opportunity to collaborate with physicians or prescribers like we do in the US. Is that correct?
That's true. That's correct.
Would it be possible in the UAE for a pharmacist to start their own practice where they are looking at medication regimens, looking at somebody's profile, and trying to figure out what might be causing problems, and then contact a prescriber to say, hey, I think that there's too many side effects from this one, and now we've got 4 other medications to work on the side effects from this one. Are you allowed to collaborate like that?
So in a hospital setting where I work, you can definitely voice your concern, but that's as far as it goes, right? But I would say pharmacists in general are too overworked or too stressed to be able to take on that extra task because it's not part of the job description, if you will. So doing that kind of work would seem like extra work to them. And I think people are just, too overworked to care, if you will.
Okay, so pharmacists are not able to open their own private practice, even from their home, to do this sort of thing that I described, medication reviews.
The idea of it seems possible, but I haven't heard of anyone who has tried doing it. And I don't think there's a market for it, so no one thinks about it.
Okay, and it's not something that in pharmacy school they encourage and train you to be aware of. Is that right?
So no, so you're definitely trained on this in school, but then you go out into the real world, and it's nothing like you've been taught. I'm not trying to sound negative or anything, but I'm just giving you the reality of it. We're trained on a lot of things, but then when you go out, you don't have the opportunity to do everything you've been trained for.
I was more referring to the entrepreneurship piece of it, where you're starting your own business and separating yourself from the actual pharmacy or the hospital. In the United States, there's a lot of movement toward pharmacists having private practices where they encourage patients to come to them individually outside of a doctor's office and allow the pharmacist to do a comprehensive medication review, identify problems and make a plan, and then collaborate with a physician to deprescribe or maybe change the medication, get pharmacogenomics involved and whatnot. It just sounds like you have maybe the same training, but not with the entrepreneurship side. Is that right?
Yes, I think it's mainly because no one thinks about entrepreneurship with pharmacy. So no one has had. So I've seen this trend, outside of our region or outside of this country. But I don't think people would think about it unless they hear more about those, successful models. So I have been trying to spread that out, spread that idea. But it's going to take time. But if it does, it would be very, very successful here.
Okay, there's a lot of good stuff going on in the United States. So I could see in the future IVPN Network Voice Podcast collaborating with some of the folks in the United States that are doing that, just to bring that to your region, to share that and those business models, just so you know what's out there. And one of the, I guess, the big brands out there is Pharmapreneur Academy, and that's run by Blair Thielemeyer. And she's a female pharmacist. She's a mom, and she's got 3 kids, and she does it all. She's amazing. And she coaches people to have their own clinical practice. There's other coaches out there, but she just has this program that's all, you just start it, and she takes you by the hand and has all these online courses. And there's another one by Dr. Asha Bohannon, the Impact Pharmacist. I'm trying to think of how to explain it. It's a brand new course, and you pay the money, of course, and you go through it online, but it teaches you how to find your target market and your niche and whatever it is that you want to do, and find out if there are enough people to support what it is that you want to do. So they're both different programs, but they're by women pharmacists. We're women pharmacists, so I got to throw that out there for other women pharmacists.
Definitely.
There's a lot of different opportunities out there. But the things that you are already talking about are more clinical based, I can tell, because what I've seen on your podcast is panel discussions, and you're talking about the COVID vaccine, things like that. And I believe you have a monthly podcast. Is that right?
Yes. We try to put it out monthly, but, having full-time jobs, so everyone on the team has a full-time job, so it gets, sometimes something slips through the cracks, but we do try to get something out there every month. Yeah.
Awesome. And who do you hope to reach? Who's your audience?
So my audience are people my age. So this, when I sit and record a podcast, I think of student pharmacists or fresh graduates who are still around my age group and are trying to find jobs, or are trying to find the passion for the profession, or a lot of people are trying to branch out and then connect pharmacy to something else of their passion, just to try to create something different. So those are the people I usually have in mind when I sit down and record something. And I just hope to just inspire them, or give them that one little push that they needed to do whatever they wanted to do. Considering that I do work as a pharmacist and I still run this podcast, which is has always been a dream of mine. I've always wanted to do a podcast, but I never had like a solid concept, if you will. And then I found this small little niche of IVPN, and I thought it would be great. So yeah.
Well, good for you. Congratulations. You're living the dream.
Thank you.
Oh, that's great. Some people, they want to do something and they keep it inside themselves. And if you don't do it, somebody else might. And you didn't miss your chance. And for that, you deserve a lot of credit. So good job.
Thank you. Thank you so much.
Now, I noticed that you have a lot of co-hosts on your podcast. Is that right? Can you tell me about that?
Okay. So we started as 2 co-hosts. It was me and Ahmed, who you've seen on the first episodes. And then Sireen came along. Sireen, who introduced us.
Mm-hmm.
She came along and kind of revamped this podcast as I know it, and she's been a lot of help. So she's been co-hosting with me now. And then we have Lean, who isn't really a co-host. She's more of our content creator, but we do put her, have her with us every now and then, just to get another voice on the IVPN Voice.
Oh, that's great. It really does take a team. If you're all working full time and you're trying to come up with content and you're trying to reach a targeted audience like you are. I mean, I do this all on my own. And some people think, oh, it must be easy, right? Because it's a one-man show. I still have to communicate with guests and I still have to come up with ideas and I have to try to target my conversations. And I'm sure you have the same issues, but with a team, it's got to be nice. And you do a good job. You get the content out there. And I've got to put a shout out to Serene because she's from my neck of the woods here in the Toledo, Ohio area. So hello, Serene.
Hi, Serene. Honestly, I love having a team. I can't imagine having to do this entire podcast thing on my own, which was the original plan, believe it or not. So it's great that a co-host just randomly came along. So the IVPN director just recommended someone. He said, "This guy is great. I think he would make a great, teammate for the Voice podcast." So it started with that, and then the bigger the team got, the more we were able to get done, and that's great with everyone having full-time jobs. So I just want to give a shout out to my team, Sireen, Ahmad, and Leen. Thank you so much for everything that you do. Thank you for putting up with me. I love you guys so much. I hope we continue doing this for a long time.
Awesome. Well, hello to your team. And I've got to say that you've said some very inclusive comments here. You have a team, you enjoy what you do. And on your podcast, I've actually heard you talk about IVPNers. Or did I say that right? IVPreneurs?
So it's IVPreneurs. IVPreneurs actually sounds like a great idea. Maybe we should. Thank you so much for the idea.
You're
So it's
welcome.
IVPreneurs who are, the members of the IVPN. So that's what they're called. That's it.
Okay. And the IVPN is actually an organization, kind of like we have the American Pharmacists Association in the United States. Is that right?
That's the goal. So this is where it's growing to be, and they're trying to simulate that to a certain effect in the UAE.
That's a great goal because here in the United States, the American Pharmacists Association, or APHA, as most of us know it, it's a great inclusive organization that takes pharmacists and offers education and networking and conference opportunities. So if you can get something like that going, that's great. And I saw on the IVPN network website that APHA is a partner of some sort of IVPN. Is that right?
They are. So Osama and Scott go way back, considering they both worked in Cleveland Clinic networks. So that's where they met, and they've continued to work together ever since. So that's how IVPN got the APHA partnership, if you will. Yep.
Oh, that's
So
great.
it's a great honor for us. Yeah, exactly. It really took it to a whole other level just with that partnership.
And you just brought up something that a lot of my listeners may not know. Cleveland Clinic is in the UAE.
Yes, they are. Yeah, so that's where I did my internship.
Cool.
So that's how I got to meet Osama Tabbara. So it's the whole thing, right? So Cleveland Clinic was brought to the capital of the UAE. So it's called Cleveland Clinic Abu Dhabi, or CCAD for short. That's what everyone calls it. And it was brought in 2013, I want to say. And they've really set the bar high for practice on all sorts of healthcare sectors. So Cleveland Clinic Abu Dhabi is what shed the light on pharmacy here in the UAE, considering that they brought the USA practice to here, and they've shown what pharmacists are able to do. So that's how the whole thing got started. That's where I found my passion, right? So I graduated pharmacy school. I wasn't really happy with what I was doing. I didn't even want pharmacy school to begin with, but I just, stuck it out. And then when I got that opportunity, it's where I really found my passion for the profession. So I'm forever grateful for Cleveland Clinic.
Awesome.
Yeah.
Well, I'm from Ohio in the US, and Cleveland's just like 90 miles away.
Yeah.
Proud to be from Ohio.
That's great.
Yeah, that's cool. See, we're connected through Serene and the Cleveland Clinic connection. It's all good.
Yep. We're doing pretty well.
Mariam, can you tell me about your job as a pharmacist there in the UAE?
So I work in an outpatient setting in one of the oldest hospitals in Dubai. In the outpatient pharmacy, there's usually a lot of insurance and pre-authorization stuff that happens. So that's my main focus. But, I do a lot of the regular pharmacist tasks. What do you want to know? I work as a pharmacist.
Do you do any IVs or parenteral nutrition?
No. So in an outpatient setting, we don't really do preparation. There's usually the simple eye drop preparation, but that's not done by me. It's usually done by pharmacy technicians. So although I would love to do that, I would love to prepare stuff, but I am unable to. But yeah, I do dispense medications. I counsel patients on their therapy. I do what is called a first fill review. So I've taken it personally upon myself to just always double check prescriptions from physicians and make sure the medication is right and that it's not interacting with anything that they're taking. So that's an extra step that I take. And a lot of people are starting to follow suit now. So it's great that, I'm trying to spread the idea of something to better patient care. So yeah, that's pretty much what my day looks like.
Very good. Well, how do you manage your job, full-time job, and podcasting on the side? Do you have time for everything?
I really don't. But, podcast recordings usually happen once or twice a month. So I try to squeeze that in there, and it doesn't sound as bad as it is. So I can manage once or twice. Like recordings per month. I can do that. And then I barely see my friends. But then that's also there's the COVID pandemic, so I don't know who to blame here. But stay tuned. We'll see who the real villain is in this story.
Yeah, it's a tough time. You can't get out to see your friends because of the pandemic, but even if you could, you're kind of busy.
Exactly.
Yeah, it's hard either way.
Exactly. You can't really win now.
I agree. I haven't seen many of my friends for a very long time, and Facebook is my friend.
Yeah. Exactly. We'll work with that for now.
Are there many women pharmacist podcasters in the UAE?
As far as I know, I think I'm the first one.
Awesome. Congratulations.
I just thought about it. I never actually, considered this. So yay for me.
I don't know if you know this, but there is a list of pharmacist podcasts, and it is put together by Dr. Erin L. Albert. She's a pharmacist, podcaster, and writer in the US. And I asked her to put the IVPN Network Voice podcast on the list.
Oh my God, thank you so much. What an honor. That's amazing. Best news I've heard today. Thank you so much.
You're welcome. It'll help get the word out, and having you on my podcast will hopefully get the word out too. I think it's great that you are a pharmacist and a podcaster. You're using your voice to advocate for pharmacy and educate others about what's going on in the pharmacy profession. And might I say, you're a little entertaining too, because like you said, people are driving, they want to hear about it, they can't be reading their email. That's kind of entertainment. So you fulfill my podcast guest criteria perfectly. Way to go.
Thank you so much. It was an honor to be on your podcast.
My pleasure. Thanks for being on the Pharmacist Voice podcast. Have a great weekend.
Thank you. You too.
Thank you for joining me for episode 95 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to subscribe and read the show notes.